Reproductive health. So I will already read some of important things in this chapter, and we will discuss only those lines, not whole chapter. Okay, so we what is healthy reproductive organs? Okay, so healthy reproductive organs with normal functions. However, it has a broader perspective and includes emotional social aspects of reproduction. According to WHO, reproductive health means a total well-being in all aspects of reproduction, that is physical, emotional, behavioral, and social. Therefore, a society with people having functionally normal reproductive organs and normal emotional and behavioral interactions might, among them in all sex-related aspects, might be called reproductively healthy. Second para. India was amongst the first countries in the world to initiate action plans and programs at the national level to attain total reproductive health as a social goal. These programs are called family planning, were initiated in 1951. RCH, reproductive and child health care programs, creating awareness among people about various reproduction related aspects and providing facilities and support for a building up a reproductively healthy society are the major tasks under these programs. In a growing population of a country, reproductive individuals are more than the reproductive individuals. With the help of audiovisuals and the print media, government and non-governmental agencies have taken various steps to create awareness among the people about reproduction related aspects, especially those in the adolescent age group, to lead a reproductively healthy life. Educating people, especially fertile couples and those in the marriageable age group. Postnatal care of the mother and child. Importance of breastfeeding, equal opportunities for the male and the female child would address the importance of bringing up socially conscious healthy family of the desired size. Awareness of problems and take up necessary steps to prevent them, thereby building up in a socially responsible and healthy society. Successful implementation of various action plans requires strong infrastructural facilities, professional expertise, and material support. These are essentially to provide medical assistance and care to people in reproduction related problems like pregnancy, delivery, STDs, abortions, contraceptions, menstrual problems, infertility, etc. Implementation of better techniques and new strategies from time to time are required to provide more efficient care and assistance to people. Statutory ban on amniocentesis for sex determination to legally check increasing menace of female feticides, massive child immunizations, etc. are some programs that merit mention in the connection. In amniocentesis, some of the amniotic fluid of the developing fetus is taken to analyze the fetal cells and dissolved substances. This procedure is used to test for the presence of certain genetic disorders such as Down syndrome, hemophilia, sickle cell anemia, etc. Determine the survivability of the fetus, Klinefelter syndrome. Usually done when a woman is between 14 to 16 weeks pregnant. Saheli, a new oral contraceptive for the female, was developed. Block estrogen receptors in the uterus, preventing eggs from getting implanted by scientists at the Central Drug Research Institute (CDRI) in Lucknow, India. Better awareness about the sex-related matters, increased number of medically assisted deliveries, and best postnatal care, leading to decreased maternal and increased mortality rates. Increased number of couples with small families, better detection and cure of STDs, and overall increased medical facilities in all sex-related problems all indicate improved reproductive health of the society. Population stabilizations and birth control. The world population, which was around 2 billion in 1900, rocketed to about 6 billion by 2000 and 7.2 billion in 2011. A similar trend was observed in India too. Our population, which was approximately 350 millions at the time of our independence, reached close to billion mark by 2000 and crossed 1.2 billion in May 2011. A rapid decline in death rate, maternal mortality rate, and infant mortality rate, as well as an increase in number of people in the reproducible age. So, maternal mortality rate, infant mortality rate, as well as increase in the number of the people in reproducible age are the probable reasons for this. Though our reproductive child healthcare programs, though we could bring down the population growth rate, it was only marginal. According to 2011 census report, the population growth rate was less than 2%, that is 22 per thousand per year, a rate at which our population could increase rapidly. Such an alarming growth rate could lead to an absolute scarcity of even the basic requirements. The most important step to overcome this problem is to motivate smaller families by using various contraceptive methods. Many couples, mostly the young urban working ones, have even adopted an one child known statutory rise of marriageable age of the female to 18 years and that of males to 21 years, and incentives given to couples with small families are two of the other measures taken to tackle this problem. Let us describe some of the commonly used contraceptive methods which help prevent unwanted pregnancies. An ideal contraceptive should be user-friendly, easily available, effective, and reversible with no or less side effects. It also should in no way interfere with the sexual drive, desire, and or the sexual act of the user. A wide range of the contraceptive methods are presently available, which could be broadly grouped into the following categories, namely natural, traditional, barrier, IUDs, oral contraceptives, injectables, implants, and surgical methods. Natural methods work on the principle of avoiding chances of ovum and the sperm's mating. Periodic abstinence is one such method in which the couples avoid or abstain from the ketos from the day 10 to 17 of the menstrual cycle when ovulation could be expected, as chances of the fertilizations are very high during this period. It is called fertile period. Therefore, by abstaining from the coitus during this period, conceptions could be prevented. Withdrawal or coitus interrupts is one method in which the male partner withdraws his penis from the vagina just before ejaculation so as to avoid insemination. Lactational amenorrhea, absence of the menstruation method, is based on the fact that the ovulation and therefore the cycle do not occur regular during the period of the intense lactation during the parturition. Therefore, as long as the mother breastfeeds the child fully, chances of conception are almost nil. However, this method has been reported to be effective only to a maximum period of 6 months following parturition. As no medicines or devices are used in these methods, side effects are almost nil. Chances of failure, though, of this method are also high. In barrier methods, ovum and sperms are prevented from physically meeting with the help of barriers. Such methods are available for both males and females. Condoms are barriers made up of thin rubber latex sheath that are used to cover the penis in the male or the vagina cervix in the female just before the coitus so that the ejaculated semen would not enter in the female reproductive tract. This can prevent conception. Nirodh is a popular brand of condom for the male. Use of condoms has increased in recent years due to its additional benefits and protecting the users from contracting STIs and AIDS. Both the male and the female condoms are disposable, can be self-inserted, and thereby gives privacy to the user. Diaphragms, cervical caps, and vaults are also barriers made up of rubber that are inserted into the female reproductive tract to cover the cervix during coitus. They prevent conception by blocking the entry of the sperms through the cervix. They are reusable. Spermicidal cream, jellies, and foams are usually used along with these barriers to increase their contraceptive efficiency. Another effective and popular method is the use of intrauterine devices. These devices are inserted by the doctors or expert nurses in the uterus through the vagina. These intrauterine devices are presently available as a non-medicated IUDs. Example given: Lipstick, copper releasing IUDs, copper T, copper 7, methyl 387, and the hormone releasing IUDs, Progestasert, LNG20. IUDs increase phagocytosis of the sperms within the uterus, and the copper ions suppress the sperm motility and fertilizing capacity of sperms. Thus, hormone releasing IUDs in addition make the uterus unsuitable for the implementation and the service hostile to the sperm. IUDs are ideal contraceptive for the females who want to delay pregnancy and or who space children. It is one of the most widely accepted methods for the contraception in India. Oral administration of small doses of either progestogens or progestogen-estrogen combination is another contraceptive method used by the females. They are used in the forms of the tablets and hence the popularly called the pills. Pills have to be taken daily for a period of 21 days, starting preferably within the first 5 days of the menstrual cycle. After a gap of 7 days during which the menstruation occurs, it has to be repeated with the same pattern till the female desires to prevent conception. They inhibit ovulation and implantation as well as alter the quality of the cervical mucus to prevent retard entry of the sperms. Pills are very effective with the lesser side effects and are well accepted by the females. Secondly, the new oral contraceptive for the females contains a non-steroidal preparation. It is once a week pill with very few side effects and high contraceptive value. Progestogens alone or in the combination with the estrogen can be used by the females as injections or implants under the skin. Their mode of action is similar to that of the pills and their effective periods are much longer. Administrations of the progestogens or progestogen-estrogen combinations or IUDs within 72 hours of the coitus have been found to be very effective as the emergency contraceptives, as they could be used to avoid possible pregnancies due to the rape or casual unprotected intercourse. Surgical methods, also called the sterilizations, are generally advised for the male and or female partner as a terminal method to prevent any more pregnancies. Surgical intervention blocks gametes transports and thereby prevent conception. Sterilization procedure in the male is called the vasectomy and that in the female tubectomy. In vasectomy, a small part of vas deferens is removed or tied up through a small incision on the scrotum, whereas in the tubectomy, a small part of the fallopian tube is removed or tied up through a small incisions on the abdomen or through vagina. These techniques are highly effective, but their reversibility is very poor. It needs to be emphasized that the selection of the suitable contraceptive method and its use should always be undertaken in consultation with qualified medical professionals. One must also remember that contraceptives are not regular requirements for the maintenance of the reproductive health. In fact, they are practiced against a natural reproductive event, that is conception or pregnancy. One is forced to use these methods to prevent pregnancy or to delay or space pregnancy due to the personal reasons. No doubt the widespread use of these methods have a significant role in checking uncontrolled growth of the population. However, their possible ill effects like nausea, abdominal pain, breakthrough bleeding, irregular menstrual cycle, bleeding or even breast cancer, though not very significant, should not be totally ignored. Medical termination of the pregnancy. Intentional or the voluntary termination of the pregnancy before full term is called the medical termination pregnancy. Nearly 45 to 50 million MTPs are performed in a year all over the world, which accounts to 1/5 of the total number of the conceived pregnancies in a year. Whether to accept or legalize MTP or not is being debated upon in many countries due to emotional, ethical, religious, social issues involved in it. Government in India legalized MTP in 1971 with some strict conditions to avoid its misuse. Such restrictions are all very important to check indiscriminate and illegal female feticides, which reported to be high in India. Why MTP? Obviously, the answer is to get rid of unwanted pregnancies, either due to casual unprotected or the failure of the contraceptive used during coitus or rapes. MTPs are also essential in certain cases where continuation of the pregnancy could be harmful or even fatal, either to the mother or the fetus or both. MTPs are considered relatively safe up to 12 weeks of pregnancy. Second trimester abortions are much more riskier. One disturbing trend usually is observed is that a majority of the MTPs are performed illegally by the unqualified quacks, which are not unsafe but could be fatal too. Another dangerous trend is the misuse of the amniocentesis to determine the sex of the unborn child. Frequently, if the fetus is found to be female, it is followed by MTP. This is totally against what is legal. Such practices should be avoided because these are dangerous both for the young mother and fetus. Effective counseling on the need of to avoid unprotected fetus and the risk factors involved in the illegal abortions, as well as providing more healthcare facilities, could reverse the mentioned unhealthy trend. Sexually transmitted diseases. Infections or diseases which are transmitted through sexual intercourse are collectively called transmitted infections or venereal diseases or reproductive tract infections. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital wounds, chromoniasis, hepatitis B, and of course the most discussed infections in the recent years, HIV leading to AIDS, are some of the common STIs. Among these, HIV infection is the most dangerous and is discussed in detail in Chapter 8. Some of these infections, like hepatitis B, HIV, can also be transmitted by sharing of injections, needles, surgical instruments, etc. with infected persons. Transfusions of the blood or from an infected mother to the fetus too, except for the hepatitis B, genital herpes, and HIV infections, other diseases are completely curable if detected early and treated properly. Early symptoms of most of these minor are and include itching, free discharge, slight pain, swellings, etc. as in the genital region. Infected females may often be asymptomatic and hence may remain undetected for long. Absence or less significant symptoms in the early stages of the infections and the social stigma attached to the STIs deter the infected person from going from timely detection and proper treatment. This could lead to the complications later, which include pelvic inflammatory diseases or abortion, stillbirths, ectopic pregnancies, infertility, or even cancer. Though all persons are vulnerable to these infections, their incidence is reported to be very high among the persons in the age group of 15 to 24. Infertility, and as discussion of the reproductive health is incomplete without an mention of infertility. A large number of couples all over the world, including India, are infertile. They are unable to produce children in spite of unprotected sexual cohabitation. The reason for this could be many physical congenital diseases, drugs, immunological, or even psychological. In India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. Specialized healthcare units, infertility clinics could be help in diagnosis and corrective treatment of some of these disorders and enable these couples to have children. However, where such corrections are not possible, the couples could be assisted to have children through certain special techniques commonly known as assisted reproductive technologies, ART. In vitro fertilization, IVF, outside the body is almost similar conditions as that in the body, followed by embryo transfer. One such method in this method, popularly known as test tube baby programs, ova from the wife or donor female and sperms from the husband or male donor are collected and induced to form zygote under stimulated conditions in the laboratory. The zygote of the early embryo with up to 8 blastomeres could then be transferred into the fallopian tube. Zygote intrafallopian transfer. An embryo with more than 8 blastomeres into the uterus, IUT, intrauterine transfer. To complete its further development, embryos formed by in vivo fertilization, fusion of gametes between the female, also could be used for such transfer to assist those females who cannot conceive. So up to 8 blastomeres is gift and more than 8 blastomeres is IUT, and gift is a transfer of gametes, ovum, collected from a donor into the fallopian tube, okay, into another female who cannot produce one, but can provide similar environment for further development in another method attempted. Intracytoplasmic sperm injections is another specialized procedure to form an embryo in the laboratory in which a sperm is directly injected into the ovum. Infertility cases, either due to the inability of the male partner to inseminate the female or due to very low sperm counts in the ejaculates, could be corrected by artificial insemination. In this technique, the semen collected from either from the husband or a healthy donor is artificially introduced either into the vagina or into the uterus, IUI, of the female. Though options are many, all these techniques require extremely high precision, handling by specialized professionals, and expensive instrumentations. Therefore, these facilities are presently available only in a very few centers in the countries. Obviously, their benefits is affordable to only a limited number of people. Emotional, religious, and social factors are also deterrents in the adoption of these methods. Since the ultimate aim of these procedures is to have children, in India we have so many orphaned and destitute children who would probably not survive till maturity unless taken care of. Our laws permit legal adoption, and it is yet one of the best methods for couple looking for the parenthood. Reproductive health requires a total well-being in all aspects of reproduction: physical, emotional, behavioral, social. Our nation was the first nation in the world to initiate various action plans at national levels towards attaining a reproductively healthy society, counseling and creating awareness. Primary step as overall improvement in reproductive health has taken place in our countries, as indicated by reduced maternal and infant mortality rates, early detection and the cure of STIs, improved health facilities and better living conditions promote an explosive growth of the population. Early detection facilitate better cure of the diseases, inability to conceive or produce children even after 2 years of the unprotected sexual cohabitation is called infertility. So we are